Welcome to my channel Health for You. What are diabetes type 1 and type 2 definition and facts? Diabetes is a chronic condition associated with abnormally high levels of sugar, glucose in the blood. Insulin produced by the pancreas lowers blood glucose. Absence or insufficient production of insulin or an inability of the body to properly use insulin causes diabetes. The two types of diabetes are referred to as type 1 and type 2. Former names for these conditions were insulin-dependent and non-insulin-dependent diabetes, or juvenile onset and adult onset diabetes. Symptoms of type 1 and type 2 diabetes include increased urine output, excessive thirst, weight loss, hunger, fatigue, skin problems, slowing healing wounds, yeast infections, and tingling or numbness in the feet or toes. Some of the risk factors for getting diabetes include being overweight or obese, leading a sedentary lifestyle, a family history of diabetes, hypertension, high blood pressure, and low levels of the good cholesterol HDL, and elevated levels of triglycerides in the blood. If you think you may have pre-diabetes or diabetes, contact a healthcare professional. What is diabetes? Diabetes mellitus is a group of metabolic disease characterized by high blood sugar glucose levels that result from defects in insulin secretion or its action or both. Diabetes mellitus, commonly referred to as diabetes, as it will be in this video, was first identified as a disease associated with sweet urine and excessive muscle loss in the ancient world. Elevated levels of blood glucose, hyperglycemia, lead to spillage of glucose into the urine, hence the term sweet urine. Normally, blood glucose levels are tightly controlled by insulin, a hormone produced by the pancreas. Insulin lowers the blood glucose level. When the blood glucose elevates, for example after eating food, insulin is released from the pancreas to normalize the glucose level by promoting the uptake of glucose into the blood cells. In patients with diabetes, the absence of insufficient production of or lack of response to insulin causes hyperglycemia. Diabetes is a chronic medical condition, meaning that although it can be controlled, it lasts or lifetime. How many people in the US have diabetes? Diabetes affects approximately 29.1 million people, 9.3% of the population in the United States, while another 86 million people have prediabetes and don't know it. An estimated 8.1 million people in the United States have diabetes and don't even know it. Over time, diabetes can lead to blindness, kidney failure, and nerve damage. These types of damage are the result of damage to small vessels, referred to as microvascular disease. Diabetes also is an important factor in accelerating the hardening and narrowing of the arteries, atherosclerosis, leading to strokes, coronary heart disease, and other large blood vessel disease. This is referred to as macrovascular disease. From an economic perspective, the total annual cost of diabetes in 2012 was estimated to be $245 billion in the United States. This includes $116 billion in direct medical costs, healthcare costs for people with diabetes, and another $69 billion in other costs due to disability, premature death, or work loss. Medical expenses for people with diabetes are over 2 times higher than those for people who don't have diabetes. Remember, these numbers reflect only the population in the United States. Globally, the statistics are staggering. Diabetes is the 7th leading cause of death in the United States, listed on death certificates in recent years.